One of the most common questions I get from members is this covered or not? You think that'd be a simple question to answer. Is the service covered or not? However, it's pretty complex. And part of that answer to that question starts when you pick your insurance. So if you're an HR person that's responsible for picking your insurance plan for your employees, one thing to think about is the exclusions. This will list the benefits that aren't covered. And today I'm going to talk about some things to really explore about exclusions before picking that plan. Hi, my name is John. I'm your healthcare hacker and a dreamer of a simpler healthcare system. Unfortunately, our system is not simple. And that's one reason we created this video series, Healthcare Hacks. We're trying to give advice to individuals, employers, and benefit brokers to help them in their own way navigate our complex U.S. healthcare system. Today, I want to continue discussing the topic of what HR people need to consider when picking out a new health plan for their employees. Specifically, I want to talk about exclusions. Now, this is a list of benefits that the plan explicitly excludes. Some of these are, we all know about. So for example, cosmetic surgery. Almost every plan excludes cosmetic surgery. Another example is something around dental care. Oftentimes that's with your dental insurance. It's not with your medical. Or if you're going to have LASIK surgery, not covered under your medical plan. Those are pretty simple and straightforward. And those exclusions, almost all of your employees will be aware of, and it won't cause any friction with them. However, there's a list of exclusions which, depending on the plan, may be covered or may not be. Let's discuss a couple common examples of where these exclusions are. So one is around bariatric surgery. Some plans cover this, some plans don't. And for some people, this is a big deal. So again, you want to make sure you understand, because you may have an employee that's pretty upset if bariatric surgery isn't covered. Another area where I see a lot of variation across plans is around alternative medicine. So things like acupuncture, massage therapy. Some plans have broad coverage. Others have very specific. We only cover acupuncture in lieu of anesthesia. That's an example I just recently saw in a plan document. Well, I could go on and list other areas where there's some differences. The important thing here is to know what your plan covers before you buy the plan. Make sure you're comfortable and you think that most of your employees are going to be comfortable with exclusions. Again, it's a big point of angst if something was covered and now it's not. So I specifically look for any changes between, especially if you're switching plans. So did last year's plan cover X and now this year's plan doesn't? You make sure you want to communicate that if you decide to go with that new plan that doesn't cover that service. Because you're going to have employees, they're expecting to be covered, and it's not. So know what it is and explain the differences. And then finally, just realize you have control. Especially if you're a bigger employer with self-insured coverage, you can decide what's included and what's not. You just don't have to go with the cookie cutter insurance plan that the carrier offers you. You have some control. I'll stop there for this episode. But if you have any questions, please leave them in the comments below, and we'll try to address them in a future episode of Healthcare Hacks. Please take a minute also and do me a big favor. Like this video. Follow Athos Health on your favorite social media platform. That way you can feed the algorithm and help us get our message out there and reach more people to give them the advice to navigate our system. And as always, make sure you get the facts by joining me in the next episode of Healthcare Hacks.